right, looks like everyone who has joined the icebreaker on AHA Slides have already started to talk about what they're feeling today. All right, so we have overwhelmed, we have distracted, we have productive, we have excited, some people feeling great, some people feeling hopeful, some people are feeling hungry. All right, that means you need to get some lunch, get some grab, take a break. Even like if you want to, grab something to eat while you're listening to the webinar, I encourage you to get some grab. Let's see what else. Normal, okay, excited, grateful. We love gratefulness, pleasant, motivated, blah. Wow, thank y'all for checking in. I just find it's important to, check in with yourself, check in with your mind, body, and spirit, and see how things are going, and kind of adjust accordingly. A couple of people are still responding. Excited, motivated, and tired. That is quite the combination. Definitely, y'all make sure y'all get some rest over this weekend, please. Alrighty. All right, going on to the next slide. So what would you like to know about housing and legal services? We have about 90 seconds to enter. What you would like to know. I will keep this information for future reference. Under the Social Determinants of Health program, we'll probably definitely revisit this topic. And so I'll use this information for future presentations. So we have people want to know about tenant rights. I too, as a tenant, would like to know more about my tenant rights. Eviction, expungement, available housing assistance, eligibility. If a tenant has concern, what legal entity can advocate for them? That's a good one. Right to counsel, where to send people with complaints about their housing, tenant rights, eviction. Okay, so we have a public health law attorney in the room. They would like to know about legal gaps. What legal gaps there are and how they can support our community. Expungement, all right. HOA rules, lead exposure in children, low-income housing rights. What folks can legally be evicted for? Available housing resources, violation and eviction notices, differences in housing in rural areas, denying housing vouchers, denying housing to voucher participants. These are some really, really good responses. Okay, we're gonna have to keep note of all of that. I'm not certain we're gonna be able to talk about all this today, but thank you for your feedback. We really, really appreciate this. And I'm gonna go to the final poll. Okay, so what would you like to know about HOPWA? Okay, can they help clients get phones and help with rent? Why there's such a long wait list? How is funding allocated? More funding. Okay, who can case managers and clients voice their complaints to about the very slow application process for housing assistance? Curious on how funding works. How can funds be used to fight discrimination based on medical, sexual, and gender identities? That's a really good one. Where are there such limitations on using funds? Speed up the payment process. We got some more folks typing. Landlord incentives for damages. Fair market value. everything. All right. How to advocate for more funding. All right. So, all right, thank y'all everyone for participating in the polls. I will definitely keep track of this, and when we revisit this topic, I will definitely see if we can include some of this information. If we are not able to include any of the include some of the information from today's session. And what I want to do is I'm going to stop sharing my screen, and I'm going to allow Kim to take over. She will be presenting on HOPWA and homelessness prevention. Hi, Kim.
Hello, excuse me. Good afternoon, good morning, everybody. I will apologize right now. I have bronchitis, so that's why I sound a little froggy right now. Please bear with me. I appreciate your patience if I need to just take a little break to grab some water. But thank you so much for joining us today. I am a program associate with Collaborative Solutions. I will be discussing HOPWA and homeless prevention. This is not meant to be, a full coverage of all of the uses for HOPWA. We will really be focusing today mainly on a few of the eligible activities under HOPWA and ways that they can serve to help people living with HIV maintain their housing, gain housing, to prevent homelessness. And I just really appreciate your comments and insights, and can't wait to dig in with you all. Just a little bit of background about me. Prior to joining Collaborative Solutions in July, I was a housing case manager here in Bloomington, Indiana, where I live, for a little over 7 years with my local AIDS service organization. I'm working with HOPWA and Ryan White and COC programs. Working with people living with HIV. I worked with a lot of people who had legal histories and saw the discrimination that folks faced as a result of those legal histories, and feel really passionate about housing access for everyone, regardless of their legal status and legal history. So I'm really excited to dig in with you all today, and just thank you for being here. And feel free to put any questions you have in the chat, and if we don't get to them today, I will also put in the HOPWA AAQ, which is the Ask a Question desk that's through the HUD Exchange. So if you have a question that you really would like to try to get an answer to around HOPWA, I'll provide that link so that we can really try to get that addressed very quickly. But yeah, just today is really meant to be a brief overview for HOPWA and how it can relate to homeless prevention and preventing evictions. So I will get my screen shared. Okay. Okay, are you all able to see my screen?
Yep.
Okay, I will get it in presentation mode. Okay, is it still showing the slides, or is it in presentation mode now? I might need to move the screens around.
It's still showing the slides.
Okay. Sorry about that. I'm just going to stop sharing for 1 second. I somehow duplicated the screens when I was trying to. Okay. There we go. Okay. So we'll just go over, or is it still showing the slides itself?
It's not showing you sharing the screen.
Oh, okay. Okay. This should be the right screen now. Is that showing? Okay, I apologize for that. Sorry. The screen share for some reason always gives me the most difficult time. So thank you for your patience.
No problem. Thank you, Kim.
Okay, so yes, as I said, we'll go over HOPWA and homelessness prevention. HOPWA stands for Housing Opportunities for Persons with AIDS. So HOPWA was established in 1990 by the AIDS Housing Opportunity Act. And the purpose of HOPWA was to provide states and localities with resources and incentives to devise long-term comprehensive strategies for meeting the housing needs of persons with acquired immunodeficiency syndrome and families of such persons. HOPWA was finalized in 1992. It's administered by the HUD Office of Community Planning and Development, specifically the Office of HIV/AIDS Housing, also known as OHH. And they are monitored by HUD, state, and local field offices. So I'm sure many of you, if not all of you, are aware of the impact that housing has on health. So research shows that as many as 70% of people living with HIV and AIDS experience homelessness or housing instability in their lifetime. And, housing is an effective structural intervention for treatment of HIV and prevention of HIV. So when people living with HIV are experiencing homelessness, they're less likely to report good health. They're less likely to take their HIV medication, adhere to taking HIV medication, have a CD4 cell count of above 200, or maintain or obtain viral suppression. So that's why, HOPWA is a really important program just to get folks housing so that they can, focus then on other goals such as viral suppression or employment. Once someone has a roof over their head, they are able to, access other needs. So what we're just going to go over a few pretty large scale slides for HOPWA and, for community need. And HOPWA assistance for communities, they really vary based on the community need. In rural communities, HOPWA need will look much different than an urban area. And so really focusing on the deliberate design of the needs of the folks in your community, while also, respecting the rules of HUD and operating in a clear and effective manner, having clear policies and procedures. We'll touch briefly on policies and procedures for STRMU and TBRA today that, are really needed for programs to be effective in implementing successful HOPWA programs, just so that, the expectations are clear for clients and staff and grantees, so that everyone has the same expectation with service delivery and understands how needs are being met and the different eligible activities that are available. And so community need, you guys are the experts in your communities much more than I am. So, you'll know what your community needs and what the issues with housing affordability are. Is it a college town like me where students are, really making it difficult for other folks to find housing, or what are the different issues that folks are experiencing to access housing. And really, as you consider that, think about the needs of people living with HIV. And, they often are, they will be the same as, the community need, because they don't, people living with HIV don't live in a silo of the whole community, right? But, we need to consider what the community need, the specific needs of people living with HIV. Do we, as a community, know what they are, and how can we find that out? And really, that's working with local partners and using your own data and knowledge to consider the ways in which people living with HIV are affected. And so really important things to consider are housing cost burden. And so HUD defines affordable housing to be when you pay no more than 30% of your income towards housing. And then there's also the affordability gap, the availability and accessibility as well of affordable units. I saw a really great question and comment in the chat about, why are people not accepting HOPWA vouchers? And we're seeing that, all across the country, even with emergency housing vouchers, there were over 70,000 emergency housing choice vouchers that were offered after the pandemic started. However, landlords are not interested in accepting these vouchers. And I think that that really points to the stigma around subsidies that there are, unfortunately. And I saw another comment about incentivizing landlords with damages. And I think that that's also, a really good conversation that we need to be having, and really educating landlords. Subsidy from the housing authority or the project sponsor who's administering HOPWA, it's guaranteed payment. And so really understanding these concerns from landlords, it's a huge issue, and that will really, it's causing a lot of barriers for folks. But within your community, seeing what that is and why things are not, units are not accessible is really important. We also need to consider, the average client household income within communities and the geography. Where is housing available? What does that look like in terms of transportation? Does it make it more difficult for someone to use, city transportation with the available housing as well? And so as you're considering your housing needs and the needs of people living with HIV, there are several different services and eligible activities under HOPWA. We will not be covering all of them today, but we will be discussing a few, but just seeing which ones feel like a priority for your community. And so there's tenant-based rental assistance and master leasing, emergency shelter and short-term housing, facility-based housing, STRMU short-term rental mortgage and utility assistance. And then there's also the supportive services such as housing case management, the Getting to Work program through HOPWA that helps folks find employment, referring folks to legal assistance. And then there's also permanent housing, permanent housing placement and resource ID. Resource ID is a more broad community resource that helps identify possible housing resources and landlords that you might be able to use in the future to develop partnerships. While permanent housing placement, PHP, is really a tool that helps people get into housing with deposit, first month's rent, which we'll discuss further, but really identifying which of these programs would really best meet the needs that are specific to your community. And so, we will be, there are several eligible HOPWA activities, and we'll be discussing today direct housing assistance and supportive services. However, there's also resource identification, housing information services, administrative expenses, and technical assistance. So those are just several different options that communities have available to them. Really, for today's purposes, we'll be discussing direct housing assistance and supportive services. So for direct housing assistance, there is facility-based housing development, acquisition, rehab, conservation and conversion, and leasing. There's also facility-based housing, operations cost, TBRA, tenant-based rental assistance, short-term supported housing, which is emergency shelter, STRMU, short-term rent, mortgage, and utility assistance, and permanent housing placement. So we'll be discussing TBRA, STRMU, and PHP today. And now we'll just take a quick deep dive into STRMU. And just again, this is not meant to be, you know, a complete 101 or deep dive into STRMU, but just to really give you the basics of the program and get you thinking more about how STRMU can be used as eviction prevention and keep folks, you know, from getting an eviction. So STRMU, I love STRMU. I've seen it really help people when they've had, you know, needed to take time off work or just had a car repair that they needed to take care of and they weren't able to pay their rent or mortgage as a result. But it is time limited, needs-based housing and utility assistance designed to prevent homelessness and increase housing stability. Assistance is provided to help homeowners and renters remain in their current place of residence. So that's really important to emphasize. STRMU is meant for the place that a person is presently residing at. Additionally, it is designed to be a short-term intervention. There are other types of rental assistance that can be used for folks with ongoing needs, such as TBRA or facility-based housing assistance. And so STRMU is designed to prevent homelessness for low-income people living with HIV. So HOPWA, there are, some general eligibility for nearly every program, except for housing information services. You have to have be at or below the 80% area median income of your city or county, which is set by HUD. And that's located on the HUD exchange. And then you also have to be living with HIV. You can be a household member living in the same household, and your whole household would qualify. So STRMU assistance is short-term and is limited to 21 weeks in a 52-week period. However, the CARES Act allows folks to have up to 24 months of assistance. And STRMU also can temporarily cover a set amount up to 100% of an overdue and ongoing rent, mortgage, or utility payment. And STRMU also must be accompanied by housing stability plan to assist the household with remaining stable after receiving assistance. So if you have a past due rent of, say, $700, that can be used for the STRMU, used through STRMU, but it also, if someone has rent due next month and they don't feel like they are able to pay that, STRMU can also be used for
to request that. And same with a utility payment, it does not have to already be past due for STRMU to actually be able to be paid. And so additional STRMU provisions, assistance must be paid to a third party, such as the mortgager, a landlord, or utility company. No cash payments can be made. And the amount of assistance may vary depending on available funds, tenant needs, and program guidelines. And just a quick note on mobile homes and trailers. They can be assisted under STRMU in limited circumstances. So they must be attached to the earth and connected to permanent utilities. So that means that mobile homes and trailers with wheels that are capable of relocating, they're considered personal property by HUD and therefore are not eligible. And so this is just a quick review of the policies and procedures for STRMU. So eligibility, just confirming the income level is below the 80% AMI. So documentation is needed. So proof of occupancy is necessary. Tracking the weeks. So no more than 21 weeks for STRMU and how that is tracked. There are several different ways in which programs can track rent or mortgage or utility assistance, and it can be days, weeks. And so there's the HOPWA guidebook has the different ways that folks can track that. And also the policy on client contributions. So this is not a requirement, but it should be considered in your policies and procedures. You know, if when you're reviewing need with clients and what the need is there, what the need is, and if there is, you know, X amount of income that it seems as though someone could pay, that kind of policy does need to be stated, just so that the expectation is clear across the board for everyone. And there also needs to be a housing stability plan defined. So the form and format of the plan, who's responsible for follow-up tasks and client expectations. So since HOPWA STRMU is a homeless prevention program, it's really necessary to ensure that, you know, there is a plan to ensure that housing stability will continue. And so, you know, what's the housing case manager or medical case manager's responsibility? What is the client's responsibility? Who's responsible for doing what? And this is not necessarily a contract. It's not meant to be punitive, but just setting up some planning in place so that there can be more just awareness in the future if there was to be, you know, another occurrence of need, then there is an awareness of, okay, well, we've tried this and this is just not working. So what else can we try? While also acknowledging that, you know, there are systemic issues at play and not all of these things are, you know, the fault of a client as well. And yeah, the link for the methods and sample calculations are in the STRMU guide, as well as the HOPWA rental assistance guidebook. And so that link is right there. And so for monitoring, I'll just go over this quickly. These are just some key elements for monitoring: client eligibility, eligibility of expenses, documentation of need, time limits on assistance, and housing needs and assessment plans. And just one more thing on documenting needs. So as I said earlier, later default notice is not required, but it can be one form of documentation to note need. And so possible documentation can be monthly bills, income assessment of need with a case manager after discussing budget. And so there are just many different ways to demonstrate someone is needing assistance. And, I always would review a budget with someone. And it also, like when I do my own budget each month, I realize every month, oh, wow, I really should spend less money on takeout. And that's never going to happen probably. But, you don't realize until you do budgets often where you're spending your money sometimes. And that doesn't, there are also obviously emergencies that happen, but reviewing your budget can really show the need and also provide room for change if you are like me spending money on a bunch of food. So it really just depends on the need. And again, that's not to say that to take away from the truly emergent situations, but budgets can just really be very, very helpful in identifying need and showing, oh, I had to spend $1,000 on my car, so obviously I can't pay rent this month. And so these are some things that are not covered by STRMU. First month's rent and deposit, however, that's covered by PHP. Personal items, vehicle maintenance and repairs, financial assistance and consumer credit or entertainment activities, phone service. However, phone services can potentially be covered as a supportive services when needed to access necessary services. So we will be touching on permanent housing placement. But before we do we want to just check in on the chat? Rodderick, what are your thoughts?
Let me see. I know you had answered some questions that we already had in the chat. There is one other question that came up about fair market value. So I don't know if you wanted to answer that particular question.
Yeah, let me.
The
Yes,
question-
thank you for that question, Elizabeth. So STRMU does not have to go by the fair market rent. It can go above it. So while HOPWA has to follow, HOPWA tenant-based rental assistance and facility-based must follow the rent standard. Short-term rental assistance does not have to. So say your rent standard for your region is $800 for a 1-bedroom and someone pays like $1,200 for their 1-bedroom, that is still an allowable payment because STRMU does not have to follow that rent standard.
And then there is another question about emergency housing for the waiting list. There's a person who is living in a car that is trying to navigate the system.
Okay. Well, thank you for your question. I'm sorry to hear about your client. I would encourage you to see if your client is on the coordinated entry list for your region, which has not just HOPWA, but other emergency housing options such as rapid rehousing, which could connect them to other places or housing resources as well. It depends on the grantee for if they have the short-term emergency housing, if they have had that as an eligible activity. So I would encourage you to check with your local HOPWA service provider to see if they do hotel stays through HOPWA, and if they don't do them through HOPWA, they might do them through Ryan White, but that is really dependent upon the, it's a local decision with how that is funded. Okay, so we'll go on to permanent housing placement. I'll let you all know that STRMU was the majority of my slides. So this part we should be moving through this pretty fast. And if you have more questions, please put them in the chat. I'm happy to answer them to the best of my ability. So permanent housing placement, I also really love permanent housing placement, PHP. It helps provide assistance to households moving into permanent housing. So that can be application fees for charged to landlords or management companies, credit check expenses, one-time utility connection fees, security deposits, first or last month's rent, renter utility arrears, mediation services, and an initial payment for rental insurance. So in my experience, this came up a lot where, folks would get approved for housing and they had no income, so they were not able to pay anything for renter's insurance. However, landlords were still requiring that. But, through PHP, we were able to pay the entire year of that policy because we did it within the first month. And so PHP can be used to pay like a whole year of renter's insurance for someone to get them into a place that's required for them to have as a condition of them living in that apartment. If it is paid by the first month. And so housing costs cannot exceed 2 months of rent value. That's really specific to the deposit. That's not, there is more flexibility for utility and past due rent as well. And it may be used for subsidized housing. So if someone is using, is receiving Section 8 and they are, needing help to just get in with a deposit, then PHP can be used for the for the deposit, but it could not be used for first month's rent because that would be considered a duplication of funds, but definitely for the deposit itself. And so supportive services, these promote housing stability and reduce homeless risk. And really case management and housing case management, I think, are the forefront of the supportive services. And I want to just emphasize supportive services are not mandatory with HOPWA. Folks can choose not to engage the entire time that they are receiving HOPWA. And if someone is not wanting to engage, I think we just really need to consider as providers the reasons why someone might not wanting to be engaged with us. If there's just not been trust established, or if they have other needs that are not being met, and just work to try to build that trust so that they feel that it is worthwhile and not harmful to engage with us as housing providers. So supportive services outside of housing case management include drug, alcohol, and mental health treatment and counseling, daycare services, personal assistance, nutritional services, intensive care, assistance in other federal, state, local benefits and services, transportations, and limited health care costs. So HOPWA is a payer of last resort for medical care. So that's why it says limited healthcare cost. We really need for HOPWA, it needs to be demonstrated that there is no other provider in order for HOPWA to pay. And so we'll touch upon TBRA, tenant-based rental assistance. So TBRA is a subsidy for the tenant to secure an affordable unit in the private rental housing market. It is a housing unit chosen by the tenant with program guidelines. It is an ongoing monthly subsidy. And so the tenant pays 30% of their income towards the rent, and the housing provider pays the rest. So if someone's income is 30% of their income is $300 and their rent $700, then the housing provider would pay $400 to make up that difference. And it's considered permanent housing. So there are no time limits for tenant-based rental assistance. Once someone receives a TBRA voucher, it does not have to be time limited. So they can have that voucher for as long as they need. There are communities who set a local preference for shorter periods to have more folks be able to access the vouchers. However, the Office of HIV/AIDS, while it's certainly understanding the want to have more folks be able to access TBRA, there is no time limit for this program for folks. And so this is the TBRA process. And so someone will complete an application and assessment, confirm the eligibility with income and HIV status. If there's a community special program focus, such as chronic homelessness, then that would be considered. And then if there's a waiting list, then that person would be placed on the waiting list. Or that person would, be, if there is no waiting list, then that person would be able to start moving towards the client housing search, where the client is given information on occupancy standards, such as limit on size for the unit, considerations for habitability, the limits on the rent cost and utility cost, which, is often a lot for someone who's new to this housing program to consider. So just reminders, I'm giving you all of this information. I'm definitely here to support you. And if you have questions or want to double check if this apartment will work, please just feel free to give me a call, and we can talk through it, as well as other program guidelines. And so here's an example of some move-in procedures. So the initial client screening of unit, client application to landlord to rent unit, the housing provider who will be providing the HOPWA subsidy will review an unsigned lease to make sure that there are no issues with the legality of that lease, confirm rent reasonableness, confirm occupancy standards, review for housing quality standards, signing of landlord participation agreement, and the W-9 form, which just sets up payment to that landlord. The client is given authorization that the move-in is acceptable and good to go, lease is signed by the client, and then the final calculation of client rent and subsidy amount. And then the account is set up with the rent amount, the W-9 and payment is set up. And then if there are any other moving costs, such as, renter's insurance or anything else that need to be addressed. And just a note of confidentiality. So just really necessary to make sure safeguards are in place, that HOPWA is not being used in any of this language or anything related to a client's HIV status. It's not up to us as providers to share that. So we definitely need to make sure that we are really considering the ways in which we're sharing information about our organization. If we are an AIDS service organization, then perhaps considering a way to disguise that a little bit so that the confidentiality of the client is protected. whenever landlords would ask me about HOPWA and what it was, they never knew it was HOPWA. They knew it was a HUD-funded program, and that was it. And I worked for a very large hospital system, so I was able to, have that confidentiality protected as a result of not having a more specific, aid service organization give the clients diagnosis or any identifying information away as a result. So it's really important to consider that as well. And so we'll be touching on the policies and procedures and operations for TBRA. And I know we just have about 10 minutes left, so I will move through these pretty quickly to give room for questions. So the policies and procedures should ensure that there's clear information on program eligibility, tenant selection, and occupancy standards. How are folks being selected? Is there a local preference, such as chronic homelessness? Client participation agreement that just explains that we will be asking for your income once a year. This is part of the program, and the things that are expected from a client without mandating supportive services. Grievance procedures that enable clients the right to complain if they feel like they are facing discrimination or an unfair thing within their housing that they feel should be able to be addressed. That's a necessary part of HOPWA programming. The housing search process, move-in procedures, emergency procedures. If an emergency comes up, what does that look like? Who will be supporting that person? Is there weekend availability? If so, what does that look like? If there is not weekend availability, who should a person contact with maintenance or the landlord? Termination of assistance and eviction. Termination is the last resort with HOPWA, and really there is a lot that should be attempted and before termination happens. And so just really considering the policies and procedures that consider termination as a last resort, assistance for surviving family members, policies around shared housing, and what are your policies around referral and waitlist management? And so, working with landlords, I really want to acknowledge the difficulty of working with landlords, and that, we are really competing with a lot of different interests. And so I just really appreciate your dedication to getting housing for people living with HIV. It's so necessary. It's so difficult. And so just ways to just kind of engage with landlords, just learn about existing units in your service area, and just try to build rapport with landlords and property managers, and introduce yourself and your agency, and maybe just do additional proactive outreach, such as reaching out to landlord associations, just reviewing newspapers, knocking on doors of places that of new developers in town or new places in town, and introducing yourself. I'm sure you all know the necessity of persistence. It's endless, but just continuing to be patient and persistent with being patient and persistent with landlords, and just continuing to advocate and recognize that they're business owners, and that renting housing is part of their livelihood. And really, how do we make it so that they want to rent to us? How do we incentivize that? And focus on how we can be helpful and respond to their needs, while also advocating for our clients in no fair housing law, so that we're making sure that our folks are not being discriminated against illegally. And then just kind of understanding landlord priorities, rent payments, apartment maintenance, being a good neighbor, and that they want units filled too. And then just like appropriate program education, I had to field a lot of, questions from landlords about, hey, what is this program? What do you do? And it's really, we provide a subsidy and we provide case management without disclosing HIV status and sharing, the positive experiences of other landlords. So I've been able to give landlords references of other landlords to really try to build that relationship. And lastly, I'll just end on these best practices for HOPWA and housing navigation in general. So housing first, harm reduction, client-centered care, trauma-informed care, and motivational interviewing, just, really recognizing that we all move through this world in very different ways, and that we just need to address the person holistically and meet them where they are, wherever that is, without putting punitive measures in place that threaten to revoke their housing if they're behaving in a way that is different than how we might behave. So thank you. And I will share my resources. Yeah, I will open it up for some more questions.
Thanks, Kim. We have two questions in the chat right now. One is, who administers or distributes PHP funding?
So so the grantees will distribute that through their different project sponsors. So that's through the Office of HIV/AIDS, and then whoever will be if you have a project sponsor locally, like an AIDS service organization, they might distribute PHP funding. So it's really locally, it depends on the local organization for who will distribute it and that availability. So I'm sorry, I can't give you a more specific information, but it depends on each grantee and how they set it up with their project sponsors.
Got it. Thank you. And the other question is, can TBRA pay for a lot rent of an unmovable mobile home?
Yes, it can, as long as it passes habitability standards and all of the other requirements of meeting rent standards as well.
Awesome. Thank you so much.
Yes, thank you. And I can share these resources as well through email. And I will just stop sharing my screen for now, since I'll share these slides. I know it's kind of hard when the screen is just showing a bunch of links you can't actually click on, so I apologize for that. Thank you all so much for your wonderful questions. Valerie C., do you need our email? And I can send the resources to NASTAD and they will share them. And I just, again, really appreciate your interest in advocacy. I just have deep appreciation for the work that you all do, and really respect it, and just want to thank you.
Thank you so much, Kim, and thank you for pulling throughout your code and everything.
Yeah,
really
absolutely
appreciate it. And definitely, go ahead and rest your voice and drink some tea. We really appreciate you, and definitely will send out that information if you send it to me, and I'll send that out to everyone, and follow up with the recordings and the slides from this presentation. So in terms of the Social Determinants of Health program, just know that we have one more part of the legal series. And so in January, we're going to focus on youth and adolescents. So we'll be releasing a memo closer to that date to register for that event. I'm looking forward to that particular one, and everyone should have a good day. Thank y'all for joining us.